So I'm Stephanie Leonard. I co-run the Perinatal and Reproductive Health group, which we call PREG, along with Allison Callahan and Louisa Smith. And these are our 2025 objectives and key results that our group has decided on. So our first one, which we led by Rupa from J&J, was to develop, implement, and disseminate a comprehensive pregnancy algorithm study within the OHDSI network, focusing on a data-driven understanding of pregnancy episodes and building the foundation for pregnancy-related studies within the OHDSI community. Although this sounds really fundamental, our group is relatively young. We just finished our second year, and just creating a comprehensive pregnancy algorithm has been one of our main undertakings that we're really excited to focus on accomplishing this year, and hopefully would be widely useful to the OHDSI community and the pregnancy researchers. And I won't read through maybe all of these. You can read through them, but these are the key results below. Our second objective is to complete a network comparative effectiveness and safety study to serve as a model for future ones. And this is something we've also been working on, especially the past year, where we've run a NIH-funded maternal health data science fellowship as part of an NIH maternal health improve initiative. And so specifically, this is one that I'm leading and would be conducting an evaluation of, there's two main antihypertensive medications that are used in pregnancy, and focusing on that and using EHR data from at least 3 institutions. There's 5 total, by the way. So this is number 3, our third objective is to incorporate pregnancy-specific EHR modules into the OMOP CDM. And I'll say kind of briefly, this has also been a challenge for our group because a lot of the EHR data for pregnancy is in a specific module of EHR in EPIC that's called EPIC Stork. And so we've been a big undertaking that we're excited that we think we have good progress on, is to finish mapping those specific elements into the OMOP CDM. And I've listed those specific elements here, which are really essential elements of pregnancy and reproductive research. And number 4 is to provide training and education to perinatal and reproductive health researchers interested in OHDSI projects. As I mentioned, we currently are more than halfway through our maternal health data science fellowship, which has been led by Paul Nagy and collaborators at Johns Hopkins. We also plan to continue running our in-person OHDSI symposium events, thinking of a study-a-thon this coming year. And we've had a lot of interest in creating a repository of materials, so we want to focus on that as well. And then our last OKR, number 5, is to develop and share phenotypes guided by newly established maternal health common data elements. So these common data elements, or CDEs, were also undertaken by the NIH Fund Improve Initiative and led by Andrea Karinga at Johns Hopkins. And so based on these, which were just released, we want to focus on establishing phenotypes for the 3 domains of the biomedical maternal health CDEs. And that is it. If you have any questions or interested in coming to our work group, please reach out.